Key point 1. Recognize the reality of ADHD as a mental disorder. Contrary to popular belief, ADHD isn't a childhood disorder. Individuals diagnosed with this syndrome as children often experience its effects well into adulthood, including symptoms like inattention and increased activity that can lead to talking louder than others. ADHD is a mental disorder that affects many aspects of life, like work productivity, career success, building happy families, friendships, and even driving safety. Today, ADHD is one of the most treatable disorders. Researchers, doctors, and scientists have been studying ways to treat ADHD in adults for years. As a result, you can benefit from their hard work and applying practical strategies to regain control of your attention. Of course, it takes effort, but the steps you'll find here will help you improve your quality of life. You may find this summary helpful if you have ADHD since a young age. You were diagnosed with ADHD in adulthood. You suspect you have ADHD due to difficulties with attention, time management, and controlling emotions. You want to understand the condition better or help your loved one diagnosed with ADHD. Here, you can access scientifically developed information about ADHD. You'll understand the importance of seeking care from a qualified specialist who can offer an individualized treatment plan to manage your symptoms effectively. You'll also learn about the potential benefits of medication and behavioral strategies in treating attention deficit hyperactivity disorder. Moreover, you'll find that behavioral strategies can help you with time management and self-organization. By working with a specialist to find the best approach, you can ease your symptoms and learn to coexist with your diagnosis. Symptoms alone aren't enough to produce a diagnosis of ADHD. You have to be impaired by those symptoms. Russell A. Barkley. Key point 2. Seek professional help if you think you have a mental disorder. Having ADHD can carry many challenges and risks. Some may struggle with impulsive spending instead of paying bills on time, have difficulty regulating social behavior, make unhealthy food choices, or use excessive alcohol and tobacco. An accurate ADHD diagnosis requires a thorough evaluation by a trained professional. People with ADHD often have difficulty with 1. Meeting deadlines and self-organization. 2. Planning activities. 3. Listening attentively without interrupting. 4. Expressing thoughts effectively. 5. Finding inner peace. And 6. Managing intense emotions. Even if you experience these challenges, that does not necessarily mean you have ADHD. Anxiety, stress, or a brain injury may also cause these symptoms. Only a qualified specialist can confirm or deny the diagnosis. Why do you need to know if you have this disorder? If the diagnosis is positive, you can immediately seek help. Plus, the negative outcome will help you pinpoint what's causing your symptoms. You won't have to torture yourself with yes or no questions. If the above difficulties resonate with you, consider how long they've been a part of your life. Did you notice them in childhood or adolescence? To be diagnosed with ADHD, these symptoms must be consistent for at least 6 months. If they are short-lived, they may have another cause. Get a head start on your ADHD assessment by learning about the typical diagnostic process, which includes several stages. 1. Having a conversation with a specialist. 2. Reviewing your medical record. 3. Undergoing psychological testing using unique methods. 4. Talking to your relatives and friends. And 5. Completing a general medical examination. Communication with your loved ones is a necessary component of the diagnostic process. Due to the disorder, individuals with ADHD can incorrectly assess their condition. Sudden changes in plans and impulsive decisions, such as moving to another city without warning, may seem normal to those with ADHD. Therefore, an outside perspective is indispensable. Parents and older relatives can also provide insight into whether you experienced similar symptoms as a youngster. Diagnosis is a brave first step to recovery. Involve your family and remember that these efforts will lead you to a better and happier life. Key point 3. Learn the nature of your disorder. Genetic factors and brain injuries influence ADHD's development. Regardless of the reason, it leads to challenges with three specific mental processes. 1. Inhibition. The disturbance of this process leads to impulsive decisions and ignoring the consequences. People who struggle with ADHD are always in the present moment, and it's difficult for them to predict the future. Number 2. Self-control. It is difficult for an individual to give up a smaller but quick reward in favor of a larger but delayed one. A lack of self-regulation leads to things like wanting to quit tedious tasks and doing something without reading the instructions first. Number 3. Executive functions. These are mental actions that help people analyze their past experiences to act better in the future. ADHD causes a person to lose track of time, forget to do important things, and not achieve their goals. Having ADHD makes social interaction difficult. A person with this disorder may unconsciously offend others and not understand their emotions and reactions. These mental problems affect your quality of life in 5 main areas. First, time management issues. Second, self-organization. Third, self-limitation. Fourth, self-motivation. And fifth, emotion control. These problems can hinder your productivity, relationships, financial management, and driving safety. Also, they make it hard to perform some social duties and interfere with comfortable relationships. ADHD makes things that seem natural to others more challenging and require additional effort. ADHD affects the brain's frontal lobe, which is responsible for your productivity. Therefore, the problem isn't a lack of knowledge, but difficulty in applying that knowledge effectively. Poor inhibition is an early symptom of ADHD. As a result, parents teach their children to think before they act, which helps them avoid risks and dangers. Without stopping to think, individuals with ADHD may burn their hands, get electrocuted, and cross the road at a red light. Pausing between actions is crucial to success. Your difficulty defending against distractions can surprise others, as it comes naturally to them. ADHD is like missing a switch that would stop all the extra impulses and help you focus. It's not your fault you have trouble paying attention. The disorder makes it harder for you. Did you know? According to Russell A. Barkley, there are fewer children with ADHD in rural areas than in urban. Key point 4. Accept ADHD as one of your baselines. We are all born with unique, unchanging features, including height, nervous system features, and temperament, which shape our lives and make up our personal norms. ADHD is one such factor that has become part of your personality. Learning to live with ADHD is a way to compensate for all the disorder's challenges and be happier. Ignoring ADHD will lead to even stronger hyperactivity and inattention, robbing you of the ability to look into the future. As a result, you can't prepare for the upcoming events until they overwhelm you one day. But if you know about the existence of the disorder, that's half the battle. Now you can do something about it. Here are strategies to help you consciously deal with executive function deficits. Involve a loved one in your interactions with the world around you. In childhood, our parents tell us how to behave in specific situations. Use this practice and ask your partner to give you tips before an essential event on the best way to respond. Or ask them to signal you inconspicuously when you make a mistake. Consciously remind yourself of important roles. Craft a list of the guidelines you want to follow and post them everywhere. Take a few minutes to think about decisions before answering, or set specific time intervals to manage things better. Repeat your rules aloud or use a voice recorder to listen to them when necessary. Divide any huge task into several smaller ones. Break a monthly project into weekly or daily tasks. Make sure you have the patience to complete them. Be kind to yourself and remain flexible. These steps are not a cure-all, and something can always go wrong. Crises will arise, but do not stop looking for ways to compensate and ask for support. Untreated ADHD can seriously hurt your social life and relationships. With an individualized medication regimen and self-awareness, these strategies can become strong pillars on the way to a more focused and peaceful life. Having a diagnosis of ADHD is like holding a passport to a better life. Russell A. Barkley. Key point 5. Consult a doctor for proper medical treatment. Medication is currently the most effective treatment for ADHD. The correct remedy can make a huge difference in how you feel. Many years of research confirm that medicine can counteract the neurological conditions that cause symptoms. It's a great achievement because only 10% of patients don't respond positively to medical intervention. Medications treat biological deficiencies and work as long as you take them, so this isn't just a Band-Aid. Of course, medication is not the only available form of treatment. It all depends on the severity of the disorder. For example, personal strategies, behavioral therapy, coaching, or support groups may be helpful in milder cases. Foregoing medication in moderate and severe cases means foregoing a better and happier life. Additionally, medication can be effective if you suffer from depression or anxiety along with ADHD. In any case, only a qualified specialist can choose the best medical treatment for you. Despite all the advantages of taking ADHD medication, people often hesitate before starting. One common fear is drug addiction. Let's explore this. There are two main types of ADHD medications. First, stimulants. Despite being classified as potentially addictive drugs, they're safe when taken orally. Second, non-stimulants. Since they don't affect dopamine, which is associated with the pleasure center, they're not addictive. As we can see, if taken carefully and following the prescribed dosage, ADHD medications can reduce symptoms and are not dangerous or addictive. When taking stimulants, you are responsible for keeping them in a place inaccessible to others. When deciding whether you should start drug treatment, remember that ADHD is not just a temporary problem with attention, but a chronic brain disorder that makes it difficult for you to live a normal life. You deserve to live a better and happier life. A qualified professional should properly diagnose you before prescribing medicine. If you're still unsure, consider seeking a second opinion. Know that you have the right to refuse medication if you feel it's not helping or causing adverse effects. Before starting medication, assess your general health and rule out possible heart problems. And the choice of medication and dosage is always a joint effort between you and your doctor, which may take some trial and error. If one medication or dose doesn't suit you, the specialist can offer another and adjust accordingly. Key point 6. Treat ADHD holistically by following your rules and principles. Despite the proven effectiveness of drug treatment, medications cannot solve all your problems. If you have had ADHD for many years, some of your responses and patterns may have become deeply rooted. Therefore, you may require a step-by-step system to develop new, more constructive ways of responding to various situations. Stress and unexpected events can make ADHD symptoms worse, and you may feel like the medication isn't working. Try these daily rules to support yourself in critical moments. Stop before you react. If you feel the urge to yell at your partner or agree too quickly to a proposal, give yourself a few seconds to think. It'll take time to teach yourself this, but it's possible. Use your catchphrase, such as, "I'm taking time for myself," and don't react in the first minute. Go back in time. ADHD doesn't allow you to apply past experiences to choose the most optimal response easily, but you can train your brain to use hindsight more often. Imagine a monitor or television in your head that shows your past. Think of a certain situation and visualize it on the mental screen. Practice this not in critical moments, but in a calm state to consolidate this habit and use it in the future. Learn to analyze the situation. Talk to yourself about a specific event and look at it from different angles. Explain what happened and why. Remember how you reacted and what it led to. Think about whether you've been in such a situation before and compare your responses. Surround yourself with reminders. Turn your space into solid clues. Stick cards on the computer monitor saying that it's time to work. Make a procedure for writing a monthly work report. Write notes to yourself that you don't need new things right now, and spread them in the pockets of your clothes. Make your environment work for you. Motivate yourself to keep going. Think about how you will feel if you don't make the report on time. Most likely, you'll continue working further to avoid feelings of shame and guilt. Use humor. Laughing at yourself helps you accept your imperfections and inspires you to deal with the issue further. Key point 7. Change your approach to life with ADHD. Receiving a precise diagnosis of ADHD can be frustrating, but it also provides the freedom to plan your life accordingly. You now know how the disorder affects all aspects of your existence, which allows you to re-examine past experiences with newfound knowledge of yourself. ADHD may have kept you from graduating college or getting a job, but with the proper treatment and behavioral strategies, you can revisit those challenges and succeed. If you have ADHD, uncontrollable anger can hurt your relationships more than other intense feelings. Here are the changes you can make in various areas of your life. Education. When pursuing higher education, remember that under the Americans with Disabilities Act, you have the right to proper accommodations, so check with your academic institution for this document. However, this does not mean you'll get an education without hard work. On the contrary, you will have to put in a lot of effort. You may need to adjust your medication dosage to keep up with the study load. Also remember to implement strategies to help you achieve your goal. Consider finding a personal trainer or mentor to help monitor the learning process and complete assignments on time. Work. When choosing a job, start with your most pronounced symptoms. For example, sitting at the computer all day may be too difficult if you suffer from hyperactivity. The good news is that there are occupations that are more suitable for people with ADHD than others. Direct sales, which involves constant movement and door-to-door work. Sports or the military, which teaches you discipline. Entrepreneurship, which allows for a flexible schedule. And creative professions, which involve increased emotionality and sensitivity. Partner relationship. While there is no one-size-fits-all solution to improving family life with ADHD, listening carefully, recalling past experiences, and meditation may be helpful. To help you stay connected with your partner, write down important dates like birthdays and anniversaries. Even if something goes wrong and you can't slow down and stop yelling at your spouse, remember that you can apologize. Understanding the effects of ADHD and love will help you and your partner cope with difficult times. Conclusion. Although ADHD makes certain adjustments to life, it does not define who you are. You are much more than this condition and can find ways to manage it. Knowing your diagnosis and a comprehensive approach to treatment will help you with this. Use these tips to adapt to living with ADHD. Study in areas where you are more likely to succeed. Work where your energy will have the highest value. Choose your living environment carefully. Ask for support from others. Continue to seek information and resources about ADHD that can benefit you. And embrace imperfection and accept yourself as you are. Treatment and behavioral strategies may not be enough to provide relief. In some cases, ADHD often coexists side by side with other mental illnesses, such as antisocial personality disorder, anxiety, or depression. In this case, it's important to consult your doctor and explore additional medications or therapy options to improve your well-being. Nevertheless, remember the importance of remaining flexible and kind to yourself. Even if the situation worsens, you can always find a way to improve it. Remember that you're not alone in your struggle with ADHD, and resources are available to help you, such as scientific research and the experiences of others who have gone through similar challenges. Seek guidance from others and see how the proper treatment strategy can make a positive change in your life. Try this. 1. Think about the situations in which impulsivity harms you the most. Write them down and involve your partner or friends in this task. 2. Create a unique, cozy place to find inner peace and meditate. And 3. Ask yourself how your day went and describe it aloud. Be careful not to disturb others while you do this.